Welcome to my genetic disease presentation. My name is Diego Solis. Today I'll be talking about anodontia. So there is actually two main types of anodontia, like shown here in the first picture. That is true anodontia, which is all teeth missing. It could be the primary, it could be the permanent teeth, or both of them as well. True anodontia happens due to many factors, and I will talk about the symptoms in a bit. But the mechanisms that occur for all the teeth to go missing in each undeveloped tooth, that is known as a tooth bud. The pathways that run through the dental lamina, as you can see on the picture on the right, it takes proteins through that dental lamina to the tooth bud, and when it gets obstructed, the tooth either doesn't grow or it doesn't emerge fully. Partial endodontia is when you're missing teeth, but not all of them are missing. True endodontia is actually related to ectodermal dysplasia. Uh, there's two types of partial endodontia. Hypodontia on the left, which is missing 1 to 5 teeth. This occurs to about 15% of the population. The other partial type is oligodontia, which is missing 6 or more teeth. This occurs to about 1% of the population. On the left, of course, hypodontia. On the middle, oligodontia, and on the right, anodontia, all the teeth missing. Like I said earlier, true anodontia is linked to ectodermal dysplasia. Some of the symptoms are closed sweat glands that obviously cause patients not to sweat, a grayish skin color, as you can see in picture A. Uh, you can barely see the hair, but they got no pigmentation and it's quite thin. And they also have problems with their nails. They're sometimes missing their nails, or they're super thin and easy to break. Moving on to the matters of inheritance, there's actually over 100 genes related to endodontia. I will go over the two that I found the most important, since they are the ones that cause for a lot of the teeth to go missing. The first one is PAX9. It causes the maxillary lateral incisors to go missing. So if you go from the right to the left, I'm sorry, it's number 7 and 10. Another key thing that causes no development in the teeth is the dental lamina channel to be obstructed, which doesn't get the right proteins to the tooth bud. That leads to no development of the tooth or defective development. It is actually an autosomal dominant gene found in the chromosome 14 in the long arm. Um, the other gene that I want to talk about is EDA. This gene is X-linked recessive, and it is linked to ectodermal dysplasia. That's why I put it in the presentation, and is related to true endodontia. It is found in chromosome number 12 in the long arm. Here's a table that shows a relationship between ectodermal dysplasia and endodontia, of course. There is 17 cases of endodontia. Out of those 17, 14 of the patients suffered of ectodermal dysplasia. So yeah, there's quite a bit of a relationship. Moving on to the diagnosis stage, it all starts when you take your kid to the dentist about 2 to 3 years old because they have not developed their teeth. If this is a case for you, they will take X-rays for the kid and see that there's no teeth in the gums. I'm sorry. They will send the kid to get examinated, to get some genetic testing done, and check the pedigrees of the family, see if anyone has suffered of endodontia before. They will also do a physical examination, see that their sweat glands are not closed, make sure that see if there's a relationship with ectodermal dysplasia, and if there is, this is when some sort of gene testing will be done. See if you have some of the genes, for example, PAX9, EDA, and if this come up positive, this will just prove the doctor's hypothesis that the patient does suffer of endodontia, possibly ectodermal dysplasia. So what do you think here, this picture, it seems a little odd, right? Well, you guessed it right. It is a little bit odd. This patient suffers of endodontia. On the picture on the left is when they put their dentures in. And basically, this shows that there is treatment for the patients. Uh, when uh, for the kids, getting the dentures measured and set up at a young age is important before they go to school, so the kids don't get discriminated. So that's the first step for the kids as they grow. And as they keep growing, new dentures are needed. They run through about 4 of them as they develop, and this is because their muscles and jaw keep growing, so the dentures are not going to fit forever. So once your kid actually reaches the age of 18, they could actually qualify for implants. When patients with endodontia need to get their bone structure redone, they could be sent to another surgeon and different specialists to get their jaw and muscles and bones, skin worked on. And these kids could also need a psychologist because they don't know what's going on. They see the other kids at school, they see that they're living a normal life, and they're over here struggling, getting surgeries, having to wear dentures, and that is important for them to know what's going on and why things are getting done a certain way. So there's actually programs like Medical Aid that fund people and help pay off these expensive surgeries. They also help to have your information and record in hospitals in case of an emergency, so doctors and people in the hospital know what's going on and that you suffer of endodontia. And as of right now, there's actually a lot of advancements being done. For example, the iTero machine is a 3D scanner that allows dentists to check what exact implant is needed and where they need to be placed for the patient. Moving on to the painful part, this is paying this all the surgeries and treatments done. So first of all, since insurance does not cover this, it isn't, or and if it is not funded, this is more than likely having to be paid by you or whoever's paying it out their pocket since they consider this a cosmetic issue. And it runs on average about 250K. This is due to, as a kid, prices start to about 13K per denture. And of course, they run through more than one. Once they move on to the implants, it is 25K per jaw. Like I said earlier, some people need to get their bone structure redone. So this one's about 150K if they need to get their whole bone structure redone in their mouth. This is done by a maxillofacial surgeon. Other miscellaneous expenses include psychologists, transportation, and this is due to the some of the specialists are now located in your places. You might need to fly to bigger cities where these surgeons are found at. Other expenses include consultation and adjustments and checkups that need to be done as the kids and teens grow. Moving on to the last part, Tom Cruise actually suffers of hypodontia, which is missing one tooth. He actually talked about how in the movie The Outsiders, he was missing a tooth and he was wearing an implant. He actually talked about how he got his veneers done, as you can see in the picture there. I don't see them nice and neat. And another cool fact is that there's a non-genetic way to get endodontia. It's not actually. I'm sorry, it's not cool. It's kind of sucks if you do get it. It is when there's a spontaneous mutation in the egg or the sperm that leads to endodontia in the person. In this case, the baby. Lastly, when we think of endodontia, we think of it as a disease. Baleen whales actually think differently. They evolved to basically having no teeth, instead having this filter-like structures that they use to filter by fish, krill, and many more food sources, easier than what they would have lived if they would have kept their teeth. That's my citations. That's pretty much it. If you have any questions about my presentation, please send me an email at diego.solis@kw